Imagine waking up feeling more drained each day. Your legs are weak, your heart works harder than it should, and no matter what you try, something just isn't right. Diabetes already complicates life. But what if something simple, something essential for your body, is missing? What if the right vitamins could help safeguard your heart and nerves and restore the energy you've been losing? Many people don't realize that a lack of a few crucial vitamins can make diabetes even harder to manage. The good news is that the right nutrients can make a world of difference. Today, we're diving into the three most important vitamins that diabetics need, because when you provide your body with what it's lacking, you regain control over your health. Number one on the list is vitamin D. Every day you might feel drained, your legs may feel weaker, and your body might ache. You could chalk it up to age, but what if the real issue is something your body's lacking? Something simple yet essential, and without it, your heart, nerves, and kidneys are silently struggling. For diabetics, this missing piece is often vitamin D, and the consequences of not having enough are serious. Over 1 billion people worldwide are deficient in vitamin D, and diabetics are at even greater risk. The facts are clear. 50% of diabetics have low vitamin D levels, which is a major concern. Without enough vitamin D, insulin doesn't function as it should, making blood sugar management even harder. But the problems don't stop there. Your heart is one of the first organs affected. Vitamin D helps keep blood vessels flexible and regulate blood pressure. But without it, vessels stiffen, blood pressure rises, and the heart works harder. People with low vitamin D have a 40% higher risk of high blood pressure and are twice as likely to suffer from heart disease. The risk of heart failure increases by nearly 50%. This isn't just about feeling tired, it's about your survival. When vitamin D levels drop, your muscles become weak, you experience cramps, and your legs can't keep up. Vitamin D is essential for muscle function, and without it, you face a higher risk of falls, slower recovery, and fractures. For diabetics who already struggle with circulation and nerve damage, this is a dangerous combination. Vitamin D is also crucial for protecting nerve cells from damage. Low levels can lead to nerve issues like tingling, burning, and numbness, which are common signs of diabetic neuropathy. In severe cases, it can even cause permanent nerve damage. What's even more alarming is that low vitamin D is linked to an increased risk of developing Alzheimer's and dementia. The brain relies on this vitamin to function properly. Kidneys, which are responsible for activating vitamin D, are also affected. Diabetes is already a leading cause of kidney disease, and if your kidneys aren't functioning well, they can't activate vitamin D. This sets off a harmful cycle, increasing the risk of kidney failure. But it's not just your body that suffers. Your mental health can also take a hit. Depression, anxiety, and brain fog are often linked to low vitamin D levels. It also plays a role in fertility and libido. Low energy, a decreased sex drive, or trouble conceiving could be signs of a deficiency. So, why are diabetics more at risk? Sunlight is the main source of vitamin D, but metabolic issues related to diabetes make it harder to produce and use it effectively. Obesity, common in type 2 diabetes, traps vitamin D in fat cells, making it unavailable. Kidney damage, certain medications, and inflammation also make diabetics more likely to be deficient. If you're wondering whether you have low vitamin D, your body sends signals: fatigue, bone pain, muscle weakness, slow healing, and frequent infections. If these sound familiar, it's time to check your levels. A blood test is the only way to confirm. Anything below 20 nanograms per milliliter is considered a deficiency. And for optimal health, experts recommend levels between 40 and 60. The good news is that you can fix this. Natural sources of vitamin D include foods like cod liver oil, which offers over 1,300 IU per tablespoon, fatty fish like salmon, 500 IU per 3.5 ounces, UV-exposed mushrooms, up to 1,100 IU per cup, and egg yolks and fortified dairy. But food alone might not be enough, especially for diabetics. Supplements like vitamin D3 with K2 are beneficial, as K2 helps direct calcium to your bones instead of your arteries. Most people need at least 2,000 IU daily, but check your levels before taking more. Certain foods can actually worsen vitamin D deficiency, including processed foods, sugary drinks, caffeine, and alcohol, which interfere with absorption. If you consume these regularly, you're making it even harder for your body to utilize the vitamin D you get. This isn't just about avoiding a deficiency. It's about protecting your heart, nerves, kidneys, and overall health. It's about preventing complications that could rob you of your health, mobility, or even your life. But the power to change is in your hands. The right foods, supplements, and a little sunlight can make all the difference. Your body is warning you. Are you paying attention? Are you paying? Number 2, vitamin E. Imagine waking up to find that your body no longer works the way it used to. Your legs feel weaker, your energy is drained, your heart is racing, your vision blurs, and your hands tremble. It feels like everything is breaking down. You chalk it up to aging, stress, or diabetes. But what if the real issue is something much simpler, something essential that your body is missing? Vitamin E is a powerful nutrient that protects cells, but millions of people, especially diabetics, lack it. The problem is, most people don't realize it. A slow, unnoticed deficiency creeps in, weakening the body over time. More than 13% of adults are vitamin E deficient, and diabetics are at an even higher risk. Diabetes increases oxidative stress, which damages cells, accelerates aging, weakens the immune system, and harms nerves. But vitamin E is supposed to combat this. It neutralizes free radicals, keeps blood vessels healthy, and protects the heart, nerves, and kidneys. When vitamin E levels drop, everything begins to deteriorate. The heart suffers first. Vitamin E keeps blood vessels strong and flexible. Without it, they become stiff, plaque builds up, and blood flow decreases, raising the risk of high blood pressure, strokes, and heart attacks. Diabetics, whose hearts are already under strain, face even greater dangers. Next, your muscles. Ever experience sudden cramps or deep pain in your legs? That's your body struggling due to vitamin E deficiency. Without enough, muscles weaken, movements slow, and tasks like walking or standing become harder. Falls are more frequent and recovery takes longer. Vitamin E also protects your skin and cells, slowing aging. Without it, wrinkles deepen, and the body heals more slowly. But it's not just about appearance. It's about how quickly your organs wear out and how much faster you feel older than you should. This deficiency speeds up the breakdown of your body. The nerves are another victim. Vitamin E is crucial for nerve protection, and without it, tingling, numbness, and pain increase. Diabetic neuropathy becomes more severe, and once nerve damage reaches a certain point, it's irreversible. Your vision also suffers. Eyes rely on tiny blood vessels, and without vitamin E, these vessels weaken, leading to blurred vision and increased sensitivity to light. Diabetic retinopathy worsens as well, potentially causing permanent damage. Additionally, vitamin E plays a critical role in hormone production, affecting fertility and libido. Low levels can lower testosterone and estrogen, impacting energy, desire, and fertility. Kidneys also bear the brunt. Diabetics already have a higher risk of kidney disease, and vitamin E deficiency worsens this. Kidneys need protection from oxidative stress to function properly, but without enough vitamin E, kidney function declines, and the risk of kidney failure increases. The terrifying part? Many people don't realize they're deficient until the damage is already significant. The symptoms start slowly: fatigue, weakness, nerve pain, vision issues, and heart problems. By the time the signs are obvious, the harm is deep. A blood test is the only way to confirm, with anything under 5 milligrams per liter indicating a deficiency. though optimal levels should be higher. To address it, focus on food. Wheat germ oil tops the list, with 1 tablespoon offering over 100% of the daily recommended intake. Sunflower seeds, almonds, hazelnuts, and spinach also provide a strong dose. However, most people don't eat enough of these foods daily to make up for a deficiency, which is why luxury meals like truffle-infused almond pate or sunflower seed-crusted salmon can provide high doses of vitamin E in a single meal. For diabetics, food alone might not be enough. That's where supplements come in. Natural vitamin E, labeled as D-alpha tocopherol, is more effective than synthetic versions. A daily 400 IU dose is beneficial, with mixed tocopherol supplements being even better. The key is to maintain balance. Not too little, not too much. Certain foods can actually worsen a vitamin E deficiency, such as processed junk foods, trans fats, refined sugars, and low-fat diets. Alcohol also depletes vitamin E levels quickly. If these foods are part of your routine, even the best supplements won't be enough. This isn't just about preventing a deficiency. It's about protecting your heart, nerves, and kidneys, stopping the pain, and slowing the body's breakdown. The right foods, supplements, and choices can make all the difference. Vitamin E deficiency might be silent, but the solution is too. The real question is, will you act before it's too late? Number 3, vitamin B12. Imagine waking up and your hands are tingling, your coordination is off, and no matter how much rest you get, exhaustion takes hold. Simple tasks become challenging. Your mind feels foggy and your heart races. You brush it off as just aging, stress, or diabetes. But what if it's something more profound? What if your body is lacking something crucial? A small but powerful nutrient that, when missing, causes everything to unravel. Vitamin B12. This deficiency can be life-changing. Over 20% of those over 60 are lacking enough, and diabetics face even higher risks. Vitamin B12 is vital for producing red blood cells, maintaining nerve health, and keeping the brain sharp. Without it, the body begins to break down. What makes it even worse? The deficiency sneaks in slowly. By the time the signs are obvious, it's already too late. One of the first problems to arise is heart-related. B12 helps control homocysteine, a blood compound linked to higher risks of heart disease and stroke when elevated. Without B12, homocysteine levels climb, causing blood vessels to stiffen, and the risk of clots rises. Studies show that low B12 can increase the risk of heart issues by 30%. Blood pressure becomes harder to control, circulation weakens, and the heart is put under stress. For diabetics, whose hearts are already vulnerable, a B12 deficiency worsens the situation. Then there's the nerve damage, the tingling, burning pain, numbness, all signs of nerve distress. B12 is essential for protecting nerves, and without it, they start to deteriorate, leading to loss of sensation, difficulty walking, and unsteady balance. Diabetics already struggle with neuropathy, but a lack of B12 accelerates the damage. Aging also speeds up. B12 plays a key role in the repair and regeneration of cells. Without it, the body ages faster. Wrinkles deepen, muscles shrink, and energy fades. The mind that once functioned clearly becomes sluggish. Memory lapses increase, and depression takes hold, making even simple tasks seem overwhelming. The longer B12 deficiency goes untreated, the harder it becomes to reverse the damage. Vision is at risk too. The optic nerve relies on B12 for proper function, and without it, the signals from the eyes to the brain weaken. Colors fade, vision blurs, and blind spots may appear. For diabetics already at risk of vision problems, a B12 deficiency heightens the danger. There's another impact rarely discussed: fertility and libido. B12 is crucial for reproductive health. For men, it affects sperm production and quality, with low levels leading to reduced sperm count and mobility. In women, B12 supports hormone balance and egg development, and a deficiency can make conception harder. Libido also suffers, with low energy and poor circulation, making intimacy difficult. The kidneys, already strained in diabetics, face even more challenges without B12. These organs depend on oxygen-rich blood to function well, and without B12, red blood cell production slows, leading to anemia and further stress on the kidneys. This increases the risk of kidney disease, a serious concern for diabetics. Why are diabetics especially vulnerable to B12 deficiency? Medications like metformin, commonly prescribed for type 2 diabetes, reduce the body's ability to absorb B12. Over time, this causes levels to drop. Other factors like digestive problems and autoimmune disorders can also affect the body's ability to extract B12 from food. The early signs are easy to overlook: fatigue, dizziness, muscle weakness, memory problems, brittle nails, thinning hair, and frequent infections. By the time more severe symptoms show up, B12 levels have likely been low for months or even years. The solution starts with food. The best sources of B12? Clams are the top choice, providing nearly 3,000% of the daily recommended intake in just 3 ounces. Beef liver is another powerhouse, offering over 2,500% in a 4-ounce serving. Fatty fish like salmon and tuna also provide a significant amount of B12. Dairy products like yogurt and cheese contribute too. For a luxurious twist, some gourmet dishes pack a B12 punch, like a seafood platter with oysters, scallops, and clams, or a rich pâté made from beef liver. Wild-caught salmon fillets drizzled with truffle butter are another nutrient-dense option. For many, though, food alone isn't enough. The best supplement is methylcobalamin, the natural form of B12 that the body can easily absorb. A standard 1,000 microgram dose is typically used to correct a deficiency. Cyanocobalamin, a stable form of B12, is also effective and is taken in doses of 500 to 1,000 micrograms daily. In severe cases, injections may be necessary to restore levels quickly. Certain habits can worsen a deficiency. Alcohol depletes B12 levels rapidly, and processed junk food, which is void of real nutrients, only compounds the problem. Diets low in animal products also put people at greater risk of B12 deficiency. A B12 deficiency doesn't just leave you fatigued. It can damage your nerves, your heart, your vision, and your kidneys. The worst part is that many people don't realize what's happening until it's too late. But the right foods, supplements, and awareness can reverse the damage before it becomes permanent. The question is, will you take action now or wait until the damage is irreversible? Thanks for watching. Leave a like, comment, and subscribe to the channel so you don't miss upcoming content. Take care of your health, stay informed, and make conscious choices every day.